Call Wesley. Matthew in Bangor. Hello, Matthew.
Hi there. Thank you for having me on the show.
My pleasure. I'm going to Bangor on Friday.
Oh, are you? It's a lovely area. It's very nice. And it's sunny today as well, which is great.
Oh, that's nice. I'm not staying long, but I'm going there to be picked up and taken to Anglesey.
Fair enough. Lovely. Okay. I'm calling from the medical perspective.
Right.
So I am a medical doctor based in North Wales, and I'm also the sustainability lead for Doctors Association UK.
Yeah.
Now, you may or may not be aware that today is also World Patient Safety Day 2024.
No, I'm not aware.
We today have launched an online resource that is designed to make climate communication around health and why it affects people in the UK specifically. And we've launched it today to try and engage more people in this conversation that climate change is affecting human health. And what we'd really like, actually, is the UK government not just to consider climate change at the centre of foreign policy, but also the centre of health policy, the centre of environment policy. And we're wanting this because it's already affecting people in the UK from a health perspective.
Tell me how.
I'm sure.
Tell me what change you'd like to see.
I'm sure we all remember the heat waves in 2022, which were brutal, and they caused over 3,000 excess deaths. Now, that's just the deaths, and it doesn't take into account the morbidity, the mortality, and the impact that it's had on people's lives. Whilst we were working in hospital during that period, we saw elderly patients with reduced mobility coming in with pressure sores that were more at risk of infection. We had more post-operative infections because it was just so hot and everyone was sweating so much more. We had electrolyte imbalances that would come into hospital and we would correct them, but they're still life-threatening.
That was all because of the extreme heat, yeah.
It's all because of the extreme heat. On a day-to-day basis, we're working in conditions that, we know the infrastructure is very old in the first place, but it's not designed and it's not adapted for extreme temperatures. And we were having to recannulate patients over and over again because they were sweating so much, and the cannulas were falling out. We were giving people loads and loads of fluids. So really, we were behind the curve on this, and we need to start talking about climate change as a health issue.
And when you say let's use health as the policy area, because it's clearly something it's central to your life. When you say we need to, all policy area needs to be informed by climate change and by climate action. Tell me what that would look like in the settings you work in. You've talked there about, hydrating people. That's in a way, that's a kind of simple, practical thing to fix, isn't it? But it's about awareness as much as anything.
Sure. So these are sort of like the practical day-to-day implications that we were experiencing. I mean, ultimately, the big things that we need to do are we need to end our dependence on fossil fuels, and we need to do that rapidly. We need to be encouraging people to do more active travel. We need to encourage people to adopt a plant-based diet and reduce their meat and dairy consumption. Now, all of these things will have positive effects on human health, and they will all reduce the burden on the health service on their own account. And we just need to be talking about this as healthcare professionals and taking collective action. I mean, collectively, we can move our own personal finances away from fossil fuel investments. We can move them away from the banks that are investing in fossil fuels. We can choose to eat one plant-based, have one day meat-free even, just to begin that transition as we move towards a more sustainable diet, as we move towards a more active lifestyle. And we can tackle both of these crises together. We can tackle the health crisis at the same time as the climate crisis. We've got a real opportunity to make a really, really positive difference and impact.
So this is about it's kind of a health reset in and of itself, but one that runs in parallel, in conjunction with climate action.
Absolutely. We know that the UK Health Service is struggling, and we have various issues in the UK, such as the obesity crisis, mental health issues are on the rise, and there are solutions to these issues that can go alongside the restoration of nature, that can go alongside making our food systems more sustainable by eating less meat and dairy, by exercising more, by just engaging with the natural world. I don't know if you'd be happy to share the resource that we've launched today.
What is it?
If I'm able to say the name.
Yes, you are.
It's an online website, and it's called ourhealthourplanet.co.uk.
That's nice and easy. Ourhealthourplanet.co.uk.
Exactly. And it's designed to either people who work in the health profession of any sort, whether you're clinical or non-clinical, and for anyone that uses the healthcare system as well. So that's basically everyone in the UK, isn't it?
Yeah, I'm just logging onto it now to have a look while I'm talking to you. Our Health, Our Planet.
No, that's fine. And our thoughts are really, like, in the UK, we have 1.6 million healthcare workers. We have 68 million people who use the health service. And we have 600 million healthcare interactions every year. Now, if we use that potential to start having these conversations about how climate change is affecting people's health, the potential is massive, and we can make a really, really big difference to both people's health and the health of the planet as well.
And the word, you describe yourself as a sustainability lead for Doctors UK. It's a word we hear in lots of different contexts, isn't it? Just how would you define it, the word sustainability?
Oh, gosh. So sustainability is used in so many different ways. For my role specifically, it's to do with sustainability in healthcare. And climate change as well. So that's specifically around how we can balance the amount of resources that we use in a healthcare setting, how we don't exceed the amount of resources that the earth can physically provide us, and just trying to have a sort of cyclical, circular economy within the health service as well.
And to make choices, because I've been thinking about it a lot from some of the sustainability work I've seen in all, both in my professional life and out and about. It seems to me it's about saying, if you keep doing this, or harvesting this, or drinking this, or eating this, or driving there, or whatever it is, if you keep doing this action, is it sustainable? As in, can you keep doing it without further damaging the planet? That to me, and I'm so glad you've called, Matthew, because I don't think most people, I certainly didn't, I don't think most people attach sustainability and that term to what you have just described, i.e. their own health. Is what you are doing sustainable and providing you with good health and being gentler on the planet in the meantime?
Exactly. And that's what we've noticed in our discussions as well, that people, rightly or wrongly, because of the way that the sort of climate and health discussions have happened over the past 50-odd years, climate change in the UK often feels like something that doesn't affect us in the UK. Certainly doesn't affect our health. It affects the polar bears or people in far-off arid lands that we might never interact with throughout the whole of our lifetimes.
It affects everybody.
We need to change that. We need to start saying that this is a UK problem. We started the Industrial Revolution. We were responsible for 100% of carbon emissions for the first 50 years of the Industrial Revolution. So this is our mess that we need to clean up.
Okay, Matthew, I have to leave it there, but thank you very much indeed, Matthew.